spread.
As the number of 911 calls from people experiencing COVID-19 symptoms continues to grow, paramedics are only taking patients in serious condition to the hospital. MedStar crews in Tarrant County are directing the others to stay at home and seek care from their primary physician instead. Our Caroline Vandergriff looks at how the process helps those lessen the strain on area hospitals.
Right now, MedStar is seeing more COVID-19 related calls than during the peak of the pandemic. Paramedics are screening about 130 patients a day for the virus. That's up 165% from where it was in June this year. MedStar is urging people to really evaluate their symptoms before calling 911. Patients with minor complaints like a mild fever, some nausea or vomiting, or a slight headache will likely get a slower response time as paramedics focus on higher priority calls. And once crews assess them, if their vital signs are good, they won't be transported to the hospital, even if they want to go. MedStar is currently implementing this protocol on about 8 patients per day, as North Texas hospitals struggle with capacity.
It doesn't make any sense to bring those patients to an already crowded emergency department when their care can easily be managed in a more appropriate setting. And it's one of the ways that we're helping to reduce the number of patients that are going to the emergency room.
EMTs and paramedics give educational material to those patients with minor symptoms and ask them to follow up with their doctor or an urgent care clinic for COVID testing and treatment. MedStar doesn't want people to hesitate to call 911 if there's a true emergency or they're experiencing serious symptoms like difficulty breathing, severe headache, and chest pain. Paramedics will always respond no matter what the call is. In Fort Worth, I'm Caroline Vandergriff, CBS 11 News.
Demand for COVID-19 vaccines in Tarrant County is slowly increasing. That's according to the county's public health director. But it is up against a concerning trend showing a rise in new cases, hospitalizations, and deaths. As Lily Zhang reports, Tarrant County first responders are doing everything they can to treat patients and not overwhelm hospitals.
Back in June, MedStar crews responded to an average of 50 patients potentially with COVID-19 each day. That daily average has more than doubled.
Now we're at 131 patients a day.
Matt Zavotsky with MedStar says that trend mirrors what the rest of the community is seeing in terms of virus spread. In Tarrant County, the COVID-19 positivity rate remains around 21%. Public Health Director Vinny Tanasia says there is a concern over the increase in hospitalized children.
So it is my appeal to those parents, get the facts, vaccine is safe, let's get your kids vaccinated. They don't have any other protections as they're going into schools.
To help hospital capacity, Zavotsky says MedStar has a protocol when it comes to patients who are potentially positive for COVID-19. If they have symptoms but are otherwise stable, fully conscious, and breathing normally, they're not transported.
We give them information, we give them printed materials on how to get tested, how to seek other care, because we're really trying to help preserve the capacity in our local emergency departments by doing that.
Back in May and June, that protocol was used once every 3 days or so, he says. They're now experiencing it about 8 times daily.
All of the frontline healthcare workers, including first responders, are right now stretched to the max.
Stretched to the max, but not without a fight. In Fort Worth, Lily Zhang, NBC5.